Hi everyone, my name's Tara Gray. For my chapter presentation, I chose to present on Chapter 6, Health Benefits Coverage and Types of Health Plans. I chose this chapter just because I felt like it would really benefit me in my current career and also my future career as well, just to have a little bit more of an in-depth knowledge about this topic. The first thing talked about in this chapter is health benefits coverage. So health benefits coverage does not dictate which services a patient can or cannot receive. It only determines which services or goods the healthcare plan is willing to provide coverage for, provide payment for. So again, it does not say that you cannot get these certain services. It only says that they will not be covered by the plan or they will be covered by the plan. Health benefits coverage also does not provide any healthcare services. They only determine which services they will and won't pay for. Um, there are three interrelated components of health benefits coverage. These are defined benefits, cost sharing, and coverage limitations. The first component of health benefits coverage is defined benefits. Defined benefits is a fairly simple concept. It really just refers to what medical goods and services are covered by your health plan. Defined benefits differ depending on the type of plan you have and by the type of health insurance you have, through which company your health insurance is provided by. There's also many defined benefits that are regulated by the Affordable Care Act. Within the Affordable Care Act, there are mandated services or goods that are required to be covered by your health plan, and these are called essential health benefits. So on top of these services and goods that your plan has decided to cover, these are also regulated by the Affordable Care Act that they must cover as well. After doing a little bit of research on these mandated benefits, these benefits that are regulated by the Affordable Care Act, there are definitely some effects seen through health insurance premiums because of these mandates. Mandated health plan benefits ultimately increase health insurance premiums. So essential health benefits are determined by the Affordable Care Act. They mandate which health benefits need to be covered by your plan, but the state is responsible for defining the essential health benefit. So the benefits that are included in the Affordable Care Act include ambulatory services, emergency services, hospitalizations, maternity and newborn care, mental health care, prescription drugs, rehab services, lab services, preventative care, and pediatric services. So these are the essential health benefits listed by the Affordable Care Act, and then it is up to the state to further define these mandated benefits and further define what type of coverage must be provided for these essential health benefits. So because of this, depending on the benefit and how your state defines it, the monthly premium can increase anywhere from less than 1% to sometimes more than 5%. The second component of health benefits coverage is coverage limitations. So with every health plan, there is going to be limitations on what your plan will and will not provide coverage for. So limitations on coverage can vary depending on who provides the service. Many health plans put a limitation on the maximum covered by a health plan. So the maximum coverage is determined by what the plan pays the provider, not what the provider charges. So that's a maximum amount your health plan will cover. There could also be limitations on the number of times a service is covered in a set period of times. One example is this: a lot of times health plans for chiropractic services, they will set limitations on how many times the chiropractic services will be covered within a 1-year period. Limitations can also be based on medical necessity. And then there's also just some services that are never covered by a health plan and that your health plan will provide no coverage or payment for. Another component of benefits coverage is cost sharing. So cost sharing is just the amount of money that a member must pay for each type of covered benefit. So while the health insurance plan does agree to provide some of the payment, you also must share the cost of the service or good with your health plan. So there's three types of cost sharings that are included. The first one is copayment. So this is a fixed amount of money per type of service. The second is coinsurance. This is a percentage of the total dollar amount that is covered. And the third is your deductible. So this is a fixed amount that members must pay out of pocket before your health insurance plan provides any coverage and provides any payment. So just to dive a little deeper into benefits coverage, there are generally three sources of benefits coverage. These include entitlement programs, individual health insurance, and group health benefit plans. So entitlement programs are simply put government-funded programs. So this includes Medicare, Medicaid, military programs, veteran programs, U.S. public health services, and Indian health services as well. For each of these plans, there's usually a set criteria that members must meet in order to be eligible for these plans. So, the prime example for that is Medicare is based on your income. Obviously, military programs would be based on your military status. These government-funded programs do account for about 40% of all national health expenditures, so they are a very large part of our healthcare system and our healthcare benefits coverage. The second source of benefits coverage is individual health insurance. These plans are purchased by an individual directly from a commercial insurance company. They're not government sponsored, they're not employer sponsored. The individual is responsible for 100% of the payments made to these commercial insurance companies, which means they are usually more expensive than definitely entitlement programs, but also group health benefit plans as well. Group health benefit plans, the most common form of this is employer-sponsored group health insurance. These type of plans are the largest source of health benefits, accounting for about 50% of all benefits coverage. In the United States, employer-sponsored health insurance is the most common way people are insured, hence why it makes up for about 50% of all health benefits coverage. To the second part of this chapter, it begins to discuss the different types of payer organizations. Our healthcare system is always changing, it's always evolving, always becoming more complex with every evolution that it sees. But one constant that has remained is that there is always a significant difference between the different types of payers, and that is really what this chapter begins to dive into. So for the first three groups that our textbook splits these healthcare payers into are nonprofit plans, for-profit plans, and member-owned plans. So nonprofit plans, the payer is not owned by an investor. Profit cannot be distributed to any individual or a group of individuals. Any profits made through these nonprofit health insurance plans belong only to the plan as a whole. The second type is for-profit plans. These are obviously owned by an investor, owned by an individual, and they can distribute their profits amongst investors however they see fit. Then there's also member-owned plans, which the members own the plan on a collective basis. These are not for-profit and not non-for-profit. The members determine how to use their profits in a collective way. The textbook then goes into talk about managed care plans. So a managed care plan focuses on reducing costs while increasing quality. They work by establishing a provider network. So this network of providers agrees to provide their services to members of the managed care plan at a reduced rate. So this is how managed care plans are able to reduce costs while still having the same high quality providers as other forms of health plans. The managed care plan also agrees to pay a higher amount of the cost if you receive your medical services from one of the providers in the network. So there's 4 different types of managed care plans. These are health maintenance organizations, preferred provider organizations, point of service plans, and exclusive provider organizations. So health maintenance organizations manages care because they require you to see a provider in your network. HMOs are offered at a much lower monthly premium than other types of managed care plans, but they also do not allow you to see any providers outside of your network. They also often require seeing a primary care physician before you're able to go and see a specialist in order to receive coverage for services from that specialist. So with HMOs, preventative care is covered at 100% of the cost, which is a benefit as well. So HMOs, they do cost less, but they also offer less flexibility. Next is preferred provider organizations. So this gives you the option to see any doctor, even if they're out of your network or in network. You do pay less though if you see a provider that is in your PPO network. There's also no referrals in order to see a specialist, and again, the health plan still provides coverage. Um, Preventative care also covered at 100%, but for this you do get higher flexibility, but you're also usually paying a higher cost for this flexibility. The third type of plan is a point of service plan. So this plan can really be thought of as a hybrid of an HMO and a PPO. You do get the flexibility to go to an in-network or out-of-network doctor like you would in a preferred provider organization, but like an HMO, you do have to see a primary care physician if you go see a specialist. So again, the point of service plan is a hybrid of the two. So costs are going to be a little higher than an HMO, but you do still get a little more flexibility than you would with an HMO, closer like you would with a preferred provider organization. The fourth type of managed care plan is the exclusive provider organization. So again, this is also a combination of an HMO and a PPO. So for this plan, unlike the HMO and the point of service, you don't need to be referred to see a specialist, and the plan will still provide coverage for you, but it is closer to an HMO in a way that you are required to see in-network doctors to be covered. So you can see a specialist without getting a referral, but it still has to be an in-network provider. So this, again, the costs are kind of right in the middle. For an exclusive provider organization plan, it is usually a little bit more expensive than an HMO, but less expensive than a PPO, and still you get a little bit more flexibility than you would from just a traditional health maintenance organization.